ಮಂಗಳೂರಿನ ಕೆಎಂಸಿ ಆಸ್ಪತ್ರೆಯಿಂದ ವಿಶ್ವ ಹೃದಯ ದಿನಾಚರಣೆಯ ಅಂಗವಾಗಿ ಎಲ್ಲಾ ವಯಸ್ಸಿನ ಗುಂಪುಗಳಲ್ಲಿ ಅನೇಕ ಹೃದಯ ಆರೋಗ್ಯ ಜಾಗೃತಿ ಚಟುವಟಿಕೆ ಆಧಾರಿತ ಕಾರ್ಯಕ್ರಮಗಳನ್ನು ಆಯೋಜಿಸಲಾಗಿದೆ ಎಂದು ಕೆಎಂಸಿ ಆಸ್ಪತ್ರೆಯ ಇಂಟರ್ವೆನ್ಷನಲ್ ಹೃದ್ರೋಗ ತಜ್ಞ ಡಾಕ್ಟರ್ ಪದ್ಮನಾಭ ಕಾಮತ್ ಹೇಳಿದರು. ಅವರು ನಗರದ ಡಾಕ್ಟರ್ ಬಿಆರ್ ಅಂಬೇಡ್ಕರ್ ಸರ್ಕಲ್ನಲ್ಲಿರುವ ಕೆಎಂಸಿ ಆಸ್ಪತ್ರೆಯ ನ್ಯೂ ಬ್ಲಾಕ್ನಲ್ಲಿ ಸುದ್ದಿಗೋಷ್ಠಿ ನಡೆಸಿ ಮಾಹಿತಿಯನ್ನ ನೀಡಿದರು. ವಿಶ್ವ ಹೃದಯ ದಿನದ ಅಂಗವಾಗಿ ಜಾಗೃತಿ ಕಾರ್ಯಕ್ರಮಗಳನ್ನು ಆಯೋಜಿಸುತ್ತಾ ಬರಲಾಗ್ತಾ ಇದೆ. ನಗರದಲ್ಲಿರುವ ಶಾಲೆ, ಕಾಲೇಜು, ಮಾಲ್, ಕೈಗಾರಿಕೆಗಳು, ಅಪಾರ್ಟ್ಮೆಂಟ್ಗಳ ಮೂಲಕ ಸಮುದಾಯವನ್ನು ತಲುಪಿ ಸಿಪಿಆರ್ ತರಬೇತಿ, ಹೃದಯ ಸ್ತಂಭನ, ಹೃದಯ ಆರೋಗ್ಯ ಘೋಷಣೆಯ ಕುರಿತು ಜಾಗೃತಿಯನ್ನ ಮೂಡಿಸಿದ್ದೇವೆ. ಈ ಕುರಿತು ಬರವಣಿಗೆ ಸ್ಪರ್ಧೆ, ಹೃದಯ ಆರೋಗ್ಯದ ಬಗ್ಗೆ ರಸಪ್ರಶ್ನೆಗಳನ್ನು ಕೂಡ ನಡೆಸಲಾಗಿದೆ. ಅದಾನಿ ಪವರ್ ಲಿಮಿಟೆಡ್ನಂತಹ ಸಂಸ್ಥೆಗಳಲ್ಲಿ ಉದ್ಯೋಗಿಗಳ ಹೃದಯ ಆರೋಗ್ಯ ಜಾಗೃತಿ ಮತ್ತು ಪರೀಕ್ಷೆಗಳನ್ನು ನಡೆಸಲಾಗಿದೆ ಎಂದು ಹೇಳಿದರು.
Emphasis was given for cardiac awareness and education, and I was happy when Mr. Rakesh, who came to me and proposed this idea of taking the cardiac awareness and cardiac rehabilitation and cardiac CPR to the students, especially in the different schools. And also he also highlighted a fact that we need to go to individual flats and make them aware of the different facilities available, and also how to give basic life support and also an education about the cardiac resuscitation. I was really thrilled by this concept, because instead of calling them to our hospital, they have gone to their doorstep and done something which is praiseworthy. It's not easy to select so many flats, so many schools. Mangalore is a hub of so many educational institutions, and they have gone to various schools and different apartments, and they imparted health cardiac education, and awareness was created among the inmates of the flat and also large section of students. And also I was very much interested in the industrial health. If you know that Mangalore is a industrial town now, there are so many small scale industries, so many startups, and each day the numbers are increasing, and we have SEZs, and we have industrial area where there are so many industries. So that was another point which was taken up. They went to Adani in Padubidri, Nandikur, and also we went to Ganjimat, that is Big Bags, which is a huge industrial complex with almost 3,500 employees.
ಕೆಎಂಸಿ ಆಸ್ಪತ್ರೆಯ ಕಾರ್ಡಿಯಾಲಜಿ ವಿಭಾಗದ ಎಚ್ಒಡಿ ಡಾಕ್ಟರ್ ನರಸಿಂಹಪ್ಪಯ್ಯವರು ಮಾತನಾಡಿ, ವಿಶ್ವ ಹೃದಯ ದಿನದ ಅಂಗವಾಗಿ ಸಾರ್ವಜನಿಕರಿಗೆ ಜಾಗೃತಿ ಕಾರ್ಯಕ್ರಮಗಳನ್ನು ಕೆಎಂಸಿ ವತಿಯಿಂದ ಪ್ರತಿ ವರ್ಷ ಆಯೋಜನೆ ಮಾಡುತ್ತಾ ಬರುತ್ತಿದ್ದೇವೆ. ಮ್ಯಾರಥಾನ್ ಓಟದ ಮೂಲಕ ಜಾಗೃತಿಯನ್ನ ಮಾಡಿಕೊಂಡು ಬಂದಿದ್ದೇವೆ. ಹೃದಯಾಘಾತ ಆದಂತಹ ಸಂದರ್ಭದಲ್ಲಿ ಹತ್ತಿರದ ಆಸ್ಪತ್ರೆಗೆ ದಾಖಲಿಸಿ ಚಿಕಿತ್ಸೆಯನ್ನ ನೀಡಿ ಎಂದು ಸಲಹೆ ನೀಡಿದರು.
So we have had marathons in the past, we have had runs to create awareness among the public, but this time we thought it a little different. We are a tertiary care hospital, and every day we deal with patients coming in with emergency. We thought that we must do something to create awareness, to have a sort of primary prevention so that the disease numbers come down and patients who develop cardiac diseases reach the hospital early. As sir has already told you that most of the deaths due to heart attack happen because of sudden cardiac arrest. So unless it is witnessed by somebody, it's practically impossible for any cardiologist to be there at the site where the heart attack happens. So the people of Mangalore, or the general public of Mangalore, and more so schools, teachers, students, all of them should be equipped with this basic skill of reviving a patient who's got a cardiac arrest. So we went with that concept this year, training people in CPR. We had our teams visiting almost 22 educational institutions. All the teachers were trained. Dr. Manish did a couple of videos so that the general public as well as the teachers are getting educated what is the correct technique of doing the CPR, so that all of them could practice, and in case of an emergency they will be able to rush the patient to the nearest hospital where cardiac care can be provided. So this time We went from a tertiary care treatment to sort of primordial or primary prevention, so that people become aware how to send a patient with cardiac disease or cardiac arrest to reach the tertiary care hospital.
ಇದೇ ವೇಳೆ ಪ್ರಾದೇಶಿಕ ಮತ್ತು ಮುಖ್ಯ ಕಾರ್ಯನಿರ್ವಹಣಾಧಿಕಾರಿ ಸಗೀರ್ ಸಿದ್ದಿಕಿ ಅವರು ಮಾತನಾಡಿ, ಬೆಳಗ್ಗೆ ಆಸ್ಪತ್ರೆಗೆ ಭೇಟಿ ನೀಡಲು ಸಾಧ್ಯವಾಗದ ಚಂದ್ರ ಆರೋಗ್ಯ ಗಮನದಲ್ಲಿಟ್ಟುಕೊಂಡು ನಾವಿಕ ಡಾಕ್ಟರ್ ರಾಜೇಶ್ ಭಟ್ ಅವರ ಕಾರ್ಡಿಯಾಕ್ ಹೊರರೋಗಿ ಸೇವೆಯನ್ನ ಸಂಜೆ ಚಿಕಿತ್ಸಾಲಯಕ್ಕೆ ವಿಸ್ತರಿಸಿದ್ದೇವೆ. ಇದು ಸಂಜೆ 5ರಿಂದ ಸಂಜೆ 7 ಗಂಟೆಯವರೆಗೆ ಕಾರ್ಯನಿರ್ವಹಿಸುತ್ತಿದೆ ಎಂದು ಹೇಳಿದರು.
World Heart Day is something which we observe every year since last so many years, and there are multiple activities that we conduct basically with the idea of creating awareness about heart diseases and the prevention. And this year we have taken the route of reaching out to the parents through the school. So we have covered 22 schools, and through the apartment we have covered a lot of apartments in and around Mangalore, so that we can reach out to as much of public as possible. And several other things. Basically, idea is to reach out everywhere in the neighborhood and create awareness on how to prevent heart diseases, and in the event of an cardiac event, what is to be done in terms of the first aid kind of activities like CPR, that has been actually taught to multiple people across various locations. The idea being to save lives when it is needed, because doctors are not around all the time. So public should also know what is to be done in the initial stages and how it has to be taken care.
ಈ ಸಂದರ್ಭದಲ್ಲಿ ಸುದ್ದಿಗೋಷ್ಠಿಯಲ್ಲಿ ಇಂಟರ್ವೆನ್ಷನಲ್ ಹೃದ್ರೋಗ ತಜ್ಞರಾದ ಡಾಕ್ಟರ್ ಎಂಎನ್ ಭಟ್, ಡಾಕ್ಟರ್ ರಾಜೇಶ್ ಭಟ್, ಹೃದಯ ಎದೆಭಾಗ ಮತ್ತು ರಕ್ತನಾಳಗಳ ಶಸ್ತ್ರಕ್ರಿಯಾ ತಜ್ಞ, ಹೃದಯ ಶಸ್ತ್ರಚಿಕಿತ್ಸಾ ತಜ್ಞರಾದ ಡಾಕ್ಟರ್ ಹರೀಶ್ ರಾಘವನ್, ಹೃದ್ರೋಗ ವಿಭಾಗದ ಎಚ್ಒಡಿ ಡಾಕ್ಟರ್ ಮನೀಶ್ ರೈ ಮತ್ತಿತರರು ಉಪಸ್ಥಿತರಿದ್ದರು. ಶರತ್ ಸಾಲಿಯನ್, ವಿ4 ನ್ಯೂಸ್, ಮಂಗಳೂರು.